COVID-19 has taken a devastating toll on residents in Canada's long-term care homes. They're among the most vulnerable to the novel coronavirus. In Canada, 8 out of 10 COVID-19 related deaths have happened in long-term care homes. Many of the facilities are chronically underfunded and short-staffed. In Ontario and Quebec, the military was called in to help, and the conditions soldiers reported in some of the homes were deplorable and heartbreaking. This week, Global News is taking a deeper look into long-term care and the challenge of fixing what's broken. Here's Ross Lord.
Retired Health and Safety Inspector Jim Chan has this advice for governments on fixing long-term care in Canada.
Don't wait till a crisis situation before you react and try to fix the problem.
In 36 years on the job, Chan noticed public and non-profit homes were generally quicker to fix problems than their private counterparts.
Some of the issue can cost quite a bit of money, and so from a profit point of view, some privately owned facility may think that, well, it's going to cost more money or lots of money. We're going to challenge your order.
There's a growing call for private operators to be pushed out of long-term care.
I think it's a huge problem. There is absolutely no room for private profiteering off the backs of seniors who can't get the care that they need.
Some private companies have managed the pandemic without any outbreaks. Others have had serious challenges. But the same can be said for the public side. The Canadian Institute for Health Information, or CIHI, estimates there are 2,100 long-term care homes in Canada, housing 190,000 people, twice as many women as men. CIHI's most recent breakdown of how they're managed is several years old. A 2014 report shows 44% had private for-profit operators, 29% were non-profit, 27% were publicly operated. Seeing the complete picture of long-term care isn't easy. CIHI, whose findings are meant to be used by policymakers across Canada, says only 8 of 13 provinces and territories participate fully in its reporting system, and that information vacuum is frustrating some researchers.
We have a lot of provinces who, frankly, have been increasingly hiding the data and hiding the information as the situations got worse, when you should absolutely be doing the absolute opposite.
Dr. Samir Sinha at the National Institute on Aging suggests there's no room for gaps in information that could lead to poor decisions. Considering 8 in 10 COVID-19 deaths have happened to people in long-term care, a system that costs Canadians $22 billion a year. Ross Lord, Global News, Halifax.
Those long-term care homes have been the epicenter of COVID-19 outbreaks in Canada. This week we're looking at why some are failing their residents and how conditions can be improved. Tonight, Ross Lord examines possible future models for this country's 2,100 long-term care facilities and the role the federal government might play.
As attention turns to preparing for a possible second wave of COVID-19, there's a new demand for the federal government. It comes from long-term care home operators in Ontario.
Ensuring there are supplies of personal protective equipment, focusing on rapid testing and prioritizing long-term care for rapid testing and turnaround.
The group that speaks for operators says there are roughly 76,000 seniors in Ontario long-term care homes for 79,000 available beds, with another 36,000 on the wait list and demand forecast to double over the next 13 years. The operators are calling on the federal government to help create another 147,000 beds. Others call for different federal action, placing long-term care under the Canada Health Act, like hospitals are. A move that could force provinces and territories to share more information on the condition of their homes.
And not simply just say, just give us more money and let us do our own thing. No. Sorry, we saw what happens when we do that. Now we're going to play a different game. It's a game called accountability. It's called a game called standards.
Those standards have been elusive in long-term care, where the ratio of nurses to residents often depends on how understaffed a home is at any given time. Even the concept of a minimum standard of care is a revealing term to those who studied it.
Who would go get your brakes fixed and say, are these minimum standards to get my brakes fixed? I mean, you're going to say, is this thing at the highest level of safety and quality that I'm looking for? So even that terminology I always found interesting.
Shirley Sharkey agrees with labor unions who demand residents receive more attention, 4 hours of care per day on average, depending on individual needs. Some standards are increasing, like Quebec offering higher salaries to recruit 10,000 long-term care workers. Federal officials say they're committed.
What we have learned has been happening cannot continue. We have to make it better, and we will.
There are no specifics on how, only a promise to transform long-term care with the cooperation of provinces and territories who are ultimately in charge of delivering health care. Ross Lord, Global News, Halifax.